Okay, welcome everyone to this session. It's at the start. I'm hoping this will be the first of a series of conversations with LGBT Olim on various, national days. So today, of course, is the 1st of December, which is World AIDS Day, and so we've been joined here by three lovely guys, Sanford, Daniel, and James. And we are, hold on a second, let me just see if I can do the video thing. There we go. That's what I want. And so we're going to talk about World AIDS Day. We'll talk about what it means to these guys. And we'll talk about what it is to live in Israel and live with HIV. So let's start. Well, let's do it in order of how long you've been here, I guess. So let's start with Daniel. Hi, Daniel. How you doing?
Well, how's everyone?
Good, good, thanks. So would you like to introduce yourself? Just tell us a little bit, where you're from, how long you've been here, that
All
kind
right.
of stuff.
My name's Daniel Premack. I was living in the United States before I made aliyah, originally from Chicago, but made aliyah from Washington, D.C., where the rest of my lovely family, my husband, that is, still lives. Um, so I had worked in clinical microbiology beforehand, and I also did uh, HIV/AIDS outreach.
Nice one. Have you been living in Israel since you said 2006 you made Aliyah?
Yeah, I made it in December of 2006. It's a
Excellent.
very
All right,
different
cool.
time.
Absolutely, yeah. Good stuff. Lovely. Thanks for that. We'll come back to you shortly. Sanford, hello.
Hi,
Unmute yourself. There we go. Hi, Sanford. How you doing?
famous disappearing hand. I'm good. My name is Sanford. I'm originally from New York. Achshav ani gar b'Yafo, thanks to Kolpan. And I've been here 3.5 years.
Nice one. Okay, cool. Lovely. Thanks for that. And finally, we'll talk about James. Talk to James. Hi, James.
Hi, how are you? My name's James. I just arrived on the 11th of November. I've been here 3 weeks. I'm originally from the Boston area, and I made Aliyah from New York City. I lived there for 30 years.
Oh, wow. Fantastic. Excellent. So we were just saying before we started recording, James, you've been in quarantine for the last couple of weeks because of the delightful COVID pandemic that we are in at the moment. So it's an interesting time because we're literally in the middle of one pandemic talking about the last one, I guess. And so I was just wondering, actually, before we get started, I mean, do you find any parallels between the two? I'm just wondering, any of you, if this has brought up anything from last time round.
Oh yeah, it
Yeah.
has. For example, when I was diagnosed back in 1995, there was no medication that worked, and when I saw my doctor, I was already with full-blown HIV/AIDS, had less than 200 T cells, and he looked at
Wow.
me and said, "Look, I can give you the AZT or the DDI, but you really need to plan for your demise."
How cheerful.
Oh well,
Mm,
honest anyway.
yeah, fair enough. So when did the good drugs start coming out?
96,
Okay, so you timed it perfectly.
you could say.
Well, timed it well. So that's good. Okay, what about the other guys? Has it brought any fond memories back?
Um, I remember in the early 80s when people would walk into a room and you could tell by looking at them that they were sick and that they were, because people were diagnosed and died 6 months later. And there was a lot of stigma. I think with coronavirus, there's also a fair amount of stigma for the people who've been infected. And I think it's why some people don't get tested, because the same that people didn't get tested for HIV because they don't want to know. They don't want to deal with it. And so I guess that's a parallel. I got infected in 94. And by that time, I personally didn't experience a lot of stigma with being HIV positive. Because by 94, we knew you could share glasses and share silverware and sit in the same restaurant and hug people. I know people from around that time who did experience a lot of discrimination in jobs and housing and things like that.
Wow. Yeah. Okay, Dame, what about yourself?
Just coming from New York, it still, was the same thing with the fear when you'd get on the train. People don't want to get near each other, and being in New York during that time as well, and also being part of CBST, which is the gay synagogue in New York City, where like 3/4 of our congregation passed away from HIV/AIDS. From the early 80s until, they finally got the meds. There was always that stigma, and you were, and also applying for aliyah, you're wondering in the back of your head, are they going to accept me? Because I have to be honest, because eventually they're going to find out, like, how far can we go with this?
So that brings up a good point, actually. I mean, and one of the reasons I wanted to do this evening's session was because one of the more commonly asked questions that I get on, the LGBT Olim email is people asking, it's like, I have HIV, can I make aliyah? And people honestly believe that it is going to be something that prevents them from moving to Israel. And I guess, I mean, it comes from a very obvious place. I mean, for a long time, I think in the US, they were on the on the form you filled in when you just arrived for a holiday or whatever. One of the questions would be, are you HIV positive? And they would put you on the next plane home, I guess, if you were. So I can understand where that question comes from. And thankfully, one of the great things about getting those emails is being able to reply and to, basically remove those fears from something. It's like, well, you will apply. They will ask you, you can disclose if you want to, okay? But even if you do, you're not going to be discriminated against. You're not going to be turned away just because you're HIV positive. And so I know for two of you, especially two of you that made aliyah within the last couple of years, it wasn't a problem at all. Is that fair to say?
Yep, absolutely.
Yeah, that's great. But Daniel, you've got a bit of a story to tell because you made aliyah back in 2004.
2006.
So,
Yeah.
Six. Yeah.
It was a different time. When I was making aliyah, I started the application process in 2004, 2005. And instead of going rather quickly, I got my visa and everything eventually, but it took a long time for Misad Panim to say, okay, because the one woman who received my application to make aliyah just set it aside when she saw I was HIV positive. I had to write to the Misad Panim and the Prime Minister's office. And when the Prime Minister's office intervened on my behalf, ultimately it worked out rather well. But I think my experience probably made it easier for everybody after me.
That's true. At least there was definitely one employee that knew what they were doing after that. So I just love I guess the stereotypical bureaucracy of that. It's like, well, I don't know what to do with that. I won't go and ask my manager what I should do.
Exactly.
I'll just put it there and hope it goes away.
Aside.
Yeah, so it's nice to know that. I mean, this is a relatively small country, and it's nice to know that a letter to the Prime Minister's office actually gets opened and read and processed. You said you spoke to the office a number of times, yes?
They called me every time. I never actually called them. I was working at Quest Diagnostics in Baltimore, Maryland, commuting from Washington, and my phone rang, and I guess I was out of the lab because I wouldn't normally answer the phone. And I answered, and it was some woman who said, "Hello, this is the Prime Minister of Israel's office calling. Is this Daniel?" And I was like, "What? Who? Huh?" And then she made it clear she was from the Prime Minister's office, and they'd received my letter, and they were terribly upset and completely embarrassed. And the PM was very angry that a person with as much a Jewish background as I had, and it's an extensive one, should be held up because of having HIV, and they were going to make it right. It took them a long time because of various vacations, but they did it.
Excellent.
Yeah.
Okay, but it's nice to know even then the policy was not for it to be a problem. It was just one person's ignorance that held things up, I guess.
Well, that plus the fact that if one person is working on something, no one else anywhere is allowed to work on it instead of them. So, you know, if Secretary A has your application and they go on maternity leave, your application sits there until they're back from maternity leave.
I would really love to think that might have changed by now, but who knows?
I can't promise that one. Israel's very different
Yeah.
from what I'm used to.
So one of the bits of advice I always give people that make aliyah is always bring a couple of months worth of medication with them. And for you guys, how long did it take for things to get set up? So, you know, you arrive here. I know from my own personal experience, the midnight that I arrived, I've been on a long flight and I was exhausted. And one of the things that they insisted that I decide there and then was which healthcare service provider I was going to go for. And I had no idea. I wanted to go with the same one as my husband, but it's not a conversation that we remembered to have beforehand. And they wouldn't let me through to talk to him. It was quite bizarre. So I was just wondering for you guys, how long did it take to get things sorted? And as a side question, I guess, how does the system here compare with that in America? But answer that one afterwards. Anyone? Let's go for you, Sanford. You did it a couple of years ago.
I came with a few months worth of medication. And I guess it's standard procedure that you decide which Kupat Cholim you're going to go with at the airport when you get off the plane, when you're least likely to make an intelligent choice. But I had already decided on Maccabi because I don't know if you remember, but I was in Facebook groups a lot before I got here asking which Kupat had the most English-speaking staff. And everybody agreed it was Maccabi because I still barely speak Hebrew at all. I can talk about my knitting and I can talk about my singing, and that's about it. And then I started researching HIV clinics here and found the one at the Crusade Kobler at Ichilov. I have a doctor I adore. And so all of my specialized medical needs are taken care of at Ichilov. And I saw him within the first few months and he put me on a new medication, and I haven't had any problems.
Okay, so you actually changed medication straight off when you arrived?
Well, we monitored my T cell count for a while and it was hovering exactly at 200. And it never went up and it never really went down. And so he changed my medication to see if we could get a boost, and we didn't. But he doesn't see any reason to change the medication because I'm not getting worse, even though the T cell count's not going up. And it's 1 pill a day, so that's great.
If I was reading up on this today, because the website I was looking at still to refer to a cocktail, but that's really not generally the case these days, is it?
Well, technically it's a cocktail because it's more than one medication in a pill.
Okay, in that respect, okay.
It's Truvada, and I don't remember what 2 medications it is, but it's a combination. But it's not the James, you raised your hand. You're on more than 1 pill a day?
No, I'm on 1, but it's 3 medications in 1 pill.
1 pill.
I'm on
okay,
5.
so in that respect, it's a cocktail. Fantastic.
I'm on more than 1 pill a day, but I've got one that's also 3 medications.
Okay. Things have improved so much. It's amazing.
Well, I remember the days when, oh God, what was the one that was so toxic that you started off at 1 pill a day, 1 pill 3 times a day for the first week, and eventually you were taking 6 pills 3 times a day.
Ritonavir?
Huh?
Ritonavir?
I don't remember. And it was so toxic that my throat swelled up and my tongue got swollen and I couldn't breathe or swallow. And my doctor took one look at me and said, you have to stop taking it, because I thought I knew better. And instead of working my way up over 6 weeks to the full 18 pills a day, I started with the 18 pills a day. And so the medications have changed a lot in the 26 years I've been positive. 26 years.
Oh,
Yeah,
I know the feeling.
So in terms of finding work, have you, I know, Sanford, correct me if I'm wrong, you're retired, correct?
Say that again.
You're retired, yes?
I'm self-employed. I got my haute couture this year, and I have a new business.
That's right, yes.
But even in New York, in Washington D.C., I didn't have a problem finding employment as an HIV positive individual.
Wonderful.
Hell, I didn't have any problem finding work using cocaine, so the HIV was not a problem.
Good stuff. What about you, Daniel?
I'm
how's the work
hunting.
situation
I'm
been?
job hunting right now, but that's not
Mhm.
because of the HIV. It's more because due to other factors, I had been or underemployed for about a decade, and finding a new job now that I'm back here full time is a little bit trickier at my age. It's more ageism than HIVism.
Wonderful. Yes, that's great, isn't it? And James, you're at the start of your journey.
I actually have a second interview tomorrow, so I got a
Didn't you have an interview yesterday as well?
Yeah,
Was that
it was,
the-
and
was the first
I
interview?
had a task to do, and then tomorrow they called this morning, and then tomorrow I have my second interview.
Fantastic. Good luck with that. What sort of work are you looking for?
Well, it's actually working at Payoneer, but I also have my first appointment at Gan Mayer in Tel Aviv.
Ah, yes, the
I
gay
work
center in Tel Aviv.
Yeah, so that'll be my first experience. I did bring 2 months medication as per you, and thanks to the meeting that we had before with, I think it was Aguda and the AIDS task force.
Yeah, Sa'ar, yeah.
Yeah, so that was
Mhm.
awesome, and that's how I chose Clalit.
Okay, cool. That's right, because we had an interview. I was doing a series of interviews with people from various LGBT organizations in Israel, and I think the last one was a few months ago now, but that was with Sa'ar from the AIDS task force.
Yep.
And so he said the same thing, yeah, to bring a couple of months of meds with you, and yeah, and by the time that runs out, everything should be sorted. Okay. Actually, I spoke to Sa'ar yesterday. Apparently, he's still with the organization, but he's no longer in charge of the customer facing service. I believe they've got the support line. I guess it's called the phone line called Bella Doeget. I hope I said that right. Doeget. Yes, that sounds right. I guess it means Bella worries about you or cares about you, I think is what they're going for. And so there's a new guy whose name I should remember. I think it's Ido Batish is the new guy. So when I upload this onto Facebook, I'll put his contact details. So he apparently is happy to answer calls and questions about how everything works in Israel. And again, in that video last time, we talked about access to PrEP, which is obviously very more popular here, and also post. What's the E stand for? Exposure. There we go. PEP as well. So for people that are worried that they've become exposed to it and want to get something to, so that's all available here as well. So which is great. So I'm trying to think what other questions I wanted to ask you guys. So you're all based in, no. Two of you are based in Tel Aviv. James, you're currently living in Netanya, is that correct?
Just outside of Netanya, correct.
Yeah. So what's your plans longer term for living? Don't know yet. Depends where the work shows up, I guess.
Right,
Yeah.
exactly. Wherever work is, that's where I'll
Nice.
start looking.
Excellent. Fantastic. I hope it all goes well. Wonderful. So are there any questions from the group that anyone would like to ask? I know there's a couple of people here that are planning on making aliyah, and someone who's literally making aliyah next week, I believe. So if anyone has any questions, please, please unmute yourselves. Anyone? It's very, very quiet for a few seconds. No? If you're worried, you can ask for a friend. Okay.
Don't be shy.
So I was wondering, how is the very personal question, I guess, how's the dating situation been for any of you? I guess it's probably not the best time to ask as well, because we are in the middle of the COVID pandemic. So even meeting people is, everything's online. Have you found?
I can't speak for anybody else, but I can't. My gaydar does not work here at all.
I can
I
understand.
the
You mean
men
not
here
your
are
app, your own inbuilt, yes?
huh?
Your inbuilt gaydar, not the app.
My inbuilt gaydar. I chose the right country since I like dark, hairy, swarthy men. And between the Israelis and the Palestinians, this is heaven on earth, and I can't tell who's on our team. I've been on exactly 2 dates through a dating app since I've been here, both with the same nut job.
You might be watching, shush.
Are you married yet?
Who, me?
Yeah.
I should only live so long. I've basically
Well, I mean,
been
if
single
you've been
for
on
40
two
years.
dates, if you've been on 2 dates with the same fella, you could be married.
Well, according to him, we were headed for a serious relationship.
Exactly.
Excellent. Okay. So maybe not a great answer. The question to ask right now. Okay.
I can
lovely.
say that for me, dating here has always been interesting because Israel comes like in opposites from my perspective. You find some people who are absolutely, completely into you and they're educated and knowledgeable about HIV, how to protect themselves, the difference between PrEP and TASP and PEP, and what they need to be on if they want to have sexual relations or if they want to use a condom or not a condom. And then there are other people who are like, oh my God, you want to do a blowjob and you don't want me to wear a condom? I'm like, yeah, because I really don't want to taste like I'm sucking on a balloon. Sorry. And they're terrified and run away. And if they find out that I'm positive, it's either, yeah, no big deal, or, oh my God, you're trying to get me sick. I'm like, I can't get you sick. I have no viral load. No, that's a lie. You're out to make people sick. You're a horrible person. And it's
Is there
both.
still a lot of that around? Do people not understand that undetectable is what's the other you stand for? Undetectable equals uncontagious. That's not the right word.
Untransmissible, yeah.
Thank you. Thank you. So where my head is tonight. So people not get that yet? Are there?
Not everyone. In Tel Aviv, I can hardly imagine what it's like outside of Tel Aviv.
In all fairness, people don't get that in the United States.
True.
Some.
Yeah. Okay, that's good to know. Okay, so there's a lot of education still need to be done. And so are there people that don't understand the risks in general, or are people still having unsafe sex, or how does it work these days? It's been off the market too long.
Well, in the States, everyone's on PrEP, so they feel like they can have unprotected sex. And that's, why it's kind of sad that, World AIDS Day has actually kind of gone on the back burner because people think, I'm not going to get it. But you still can. And there's other things you can get, from the unprotected sex.
That's true. That's a good point. That PrEP is not 100% effective. Yeah. And as you said, there's plenty of other STIs that are available as well. Available.
Before HIV, I remember herpes was the thing that everybody was afraid of.
Right.
You can still get herpes.
That's very true.
And before herpes, it was crabs.
That was always, I thought.
Lovely.
Little cocktails.
So at least that one can get treated. With herpes, you got that one for life as well, have you not?
Yeah.
Yeah. No, exactly.
And just get a little cocktail sauce and you'll be fine if you got the crabs.
Nice.
Say what?
So what does World AIDS Day mean to you guys? I mean, this comes around every year. Is it something that's that registers, or is it something that can pass you by each year? Daniel, let's go for you first.
Oh, great. For me, it's a time of reflection sometimes. And other times, yeah, I just forget it's December 1st and it goes right by. But this year, it's been a little more difficult than other years, not because of AIDS, but because of Corona. I've lost people due to Corona, and it made me think about all of the people that I'd lost due to HIV. So a little bit sadder today than normal.
Yeah, I can imagine. Sanford, what about yourself?
It tends to just go by for me. I've been living with it for so long. It's kind of, living with it is kind of a constant. So a single day doesn't really jump out at me.
Okay. And James?
For me, it also, I think of the past when everyone used to, be in fear of it, and then people got educated about it. And today, people really don't think about it because they don't think they can get it anymore. So it's kind of worrisome that it has been put on the back burner. But at the same time, and then with the whole COVID thing now, it's even gone further to the back. But like Daniel said, with the whole COVID thing, is it brings up so many memories of the late 80s and early 90s. Because and now in New York, I lived in Jackson Heights. We were the epicenter of the coronavirus. We were right next to it was 2 blocks from Elmhurst Hospital, and you could see the bodies being put into the freezer trucks. And so it was really quite frightening.
The one issue it brings up for me, and I still encounter this every once in a while, is the lack of awareness of the history of the AIDS crisis. Because people who were born in the 80s or 90s don't remember, they have no knowledge of what life was like before HIV. And I came out in 77, and I had a friend in Springfield, Illinois, who died in 79, and he was in the hospital, and he had flu-like symptoms, and the antibiotics weren't working, and he had lesions on the brain. Well, in retrospect, it was HIV, and the lesions on the brain were Kaposi sarcoma, and the reason it didn't respond to antibiotics is because it was AIDS. But there are so many people who they don't know the history. We haven't done anything with the Names Project quilt in so long that people don't even know there was a Names Project quilt. And the second year it was in Washington, D.C., I helped unfold it.
Oh, wow.
Which was, I cried the whole day. It's just devastating. And there are so many people who just have no concept of what it was like in the 80s. If you sang in a gay chorus, the whole chorus was decimated. Whole generations of Broadway producers and actors and dancers and designers were gone. And young people don't care. They don't know.
I've always been involved with the leather community. Growing up in Chicago is where the International Mr. Leather Contest has always been held. And I was friends with and active in that group since before it was legal for me to do so. And you'd see there'd be this year where there were 50 guys ready to compete, and then there'd be the one guy who was competing, but he was looking like he just came out of Auschwitz, and you just wondered if he was going to make it through the entire event. And then we lost one of the founders very early on, and then other people a little bit later. You'd hear, oh, your friend over there, James, got sick last month. He's over at St. Joseph's Hospital if you want to catch him before he goes. And that was how we were thinking, you run over to say your goodbyes because the next day they could be gone. And it didn't take a week sometimes for people to die. It took days. The pneumonia would get them so quickly. It was awful. And the idea that people in the United States are saying, I don't have COVID, and they're getting intubated moments before that, or moments after they've said that. Oh, it just boggles my mind.
That's one thing that has amazed me this year, because I remember thinking, I was born in '73, so AIDS had already happened, I guess. And I remember growing up with the scare tactic ads on TV, and I think like I wasn't in Australia at the time. In Australia, they had like adverts with death with his scythe. That was how like heavily they pushed it. Um, and I remember thinking, it's like, you hear about all the criticism of Ronald Reagan and how little he did and so on. And I remember thinking, like, if this was a pandemic that was affecting everybody, it would be so different. And this year, I've been proven wrong. It's like it really doesn't matter whether it's a small demographic that is looked down upon, because of homophobia, or whether it's affecting the entire country. There are politicians that will literally just bury their head in the sand and pretend it's not happening, and say it'll just miraculously disappear on its own. So that has kind of been an ironic realization for me that it wasn't just because it was it was the gays, it was the homosexuals that were getting it and nobody else, which wasn't true at the time anyway. The fact is, some politicians are quite happy to lose swathes of the population and still do nothing. It's quite tragic, really. Yeah.
I'd say there is a difference. It's not a happy difference. We
Yeah.
got from diagnosis or discovery of COVID to a vaccine in less than 1 year.
Mm.
That's the political situation.
Mm.
It's 40 years and we still don't have a vaccine, which clearly could probably be developed if there was the investment and the political willpower to do so. But I think you're right. It's those people.
Well, yes. And part of the reason we don't have a virus for HIV is because of President Reagan, who didn't utter the word AIDS. Maybe, I think he said it once toward the end of his time in office.
Yeah.
And because it was thought of primarily as a gay disease, politicians were loath to really jumpstart anything, unlike COVID, which affects gay, straight, young, old, Catholic, Baptist, Jewish. And so, and you have to wonder, if Hillary had been elected, where we'd be with COVID in the United States right now. I think it would be a completely different picture if we had somebody who believed in science in the White House.
On many levels.
The problem with today's politics is, of course, belief outweighs science. And it's not just in America or just in Israel, it's worldwide. Suddenly there is, my belief trumps your reality, even though your reality is science-based. It's craziness that I don't quite understand how we ended up here, but I think we can blame Rupert Murdoch and other Australian media for spoon-feeding the population that kind of thought process. For me, the one thing that I will say about living here versus living there in the USA is that I walk into the Kupat Cholim, I tell them I need my HIV medication. As long as they have it on hand, they're happy to hand it to me. And I pay a pittance, if anything at all. I had to go back to the United States where I no longer am covered by insurance and I ran out of one of my drugs. That made a whole big difference because suddenly I would have had to have paid over the counter. And over the counter fees in the United States were thousands of dollars for 1 month's supply.
$3,600 for mine. If
yeah, mine was more.
But here, the reason Superfund doesn't carry my HIV medication is because it's 3,500 shekels.
Yeah.
Whereas I don't pay anything at Maccabi. So the equivalent happens here too.
But the difference is here, 3,500 shekels is still a third of what you would pay for your HIV medication without insurance in America.
Well, let's hear it for big pharma controlling drug prices in the US.
Yep.
So it's a nice thing to know that you're going to have your medications covered whether you're rich, poor, employed, or unemployed here. Whereas in the United States, if you were unemployed or self-employed and you weren't on or couldn't get Obamacare for whatever reason, or it was before Obamacare, you were essentially out of luck.
Well, there's been Medicaid for a long, long time, even before Obamacare. And
Yeah,
Medicaid
but you
covered
had to get
everything.
on Medicaid. A lot of people didn't fall in that category. They made too much for Medicaid and not enough.
But if you were unemployed and you had medical issues, you were eligible for Medicaid.
Yeah, but you don't get all your drugs that way. They're not. You don't. It's like when I first came here. My doctor here said to me, "Oh, we don't have that drug in Israel yet. I'll put you on Coletra." And I said, "No, I can't take that." And he's like, it was a very different experience because until I said that, he had yet to look up from his computer. And when I said that, he said, "And what's your profession?" And I told him I was a microbiologist. And he said, "Oh." And then we had an actual conversation. And when I left that conversation with him and we'd resolved the medicines that would make the most sense for me, his head nurse says to me, "Daniel, we don't talk to doctors that way in Israel." I said, "I'm not from Israel, and I'll talk to a doctor who's treating me the way I think they need to be talked to." And she was in absolute shock. But from that day forward, she and my doctor there have been like they're my biggest fan and I'm theirs. We have great conversations and it's open and honest. So if you can do that, if you have the ability to stand in front of the doctor and say, "No," or "Can we discuss this?" and not just take their word for it and advocate for yourself, you're going to do better, just like in the US. Self-advocate. It's very
One thing I
important.
have heard from...
No, I did it all in English.
Because I'm my own best advocate, and I have been since I first got the tubes in 2005. But the problem that I have is it's really hard to advocate for yourself when you're dealing with support staff who don't speak English.
I totally understand that. But yeah, no, my doctor and his nurse both speak enough English that it was communicable.
Both
And-
my doctors speak English.
And now my Hebrew is sufficient because when I made aliyah, I did ulpan for medical professionals, partially because I knew I would need to talk to doctors and partially because my job was in the medical professions. But I don't even know if they offer that anymore. But it was a great way to make ulpan. If you can do an ulpan for a professional service, it doesn't matter what profession you're in, try to get a professional ulpan from Mishlada Klita, because they will teach you the jargon you need to know. And that's very helpful.
Good plan. Nice one. There's something else I was going to ask you there as well. So one thing I've heard from a lot of Americans is that, yes, the healthcare system is substantially cheaper here than it is in the US, but you don't get the care and attention from the doctors that you would be used to in the US. One of the examples someone gave me is like, you go for blood tests. Here, your family doctor will recommend that you have blood tests every year, just general, everyone should do that. But you go and the results get uploaded to the website, so you can log into your health provider's website and you can see the results. They give you a little scale and they tell you what's expected and what's not, and it gives you a nice little red little icon if you're outside the scale. But your doctor doesn't phone you and explain what those numbers mean, and it's up to you to make an appointment with the doctor and say, "Well, I've got this, I've printed this out. Can you actually tell me what these numbers mean? Am I going to die next week, or am I, or is it just going to, I don't know, go away on its own?" That kind of thing. But as you said, you need to be your own best advocate. You're a push.
Has
You
that
get
been
what you
your
need.
experience?
Mine,
Yeah.
I've had annual blood tests, and often I log into the website, and thankfully, I don't have too many things to worry about. Last time I checked, it's been a while. But again, there were a couple of things that were just off the scale, and you click on the little icon, it pops up a little window saying what the side effects are, and I'm thinking, oh, that's not so bad. But again, I've had to go and ask the doctor, so, well, I had the blood test as you recommended. Tell me what I should be doing. Tell me, should I be doing something as a result of this, or am I okay? That's not an automatic process here.
I don't think it's
yeah,
an
if you don't
automatic
follow
process
that
in the US either.
Yeah, it is. Yeah.
For you?
I would go for my blood tests every 6 months, and Quest would send me my results.
Mm-hmm.
The doctor would hate that, and he would say, no, I want you to come in and we'll discuss what the results are.
Well, I know why he did that.
My doctor was always very accessible to me. In fact, I had a 917 cell phone number for him.
Did you have Dr. Shea?
Huh?
Did you have Dr. Shea in New York?
No, I had, oh my God, Juan, what was Juan's last name? At Beth Israel. And he was great. And if I knew I had to go to the emergency room, or if I felt like I should, I would call him and tell him my symptoms and what my fever was. And he would call ahead to the emergency room and say, he's on his way. He would see me in the hospital to check in on me. I had a great doctor when I was first diagnosed with gastroparesis, who was with me every step of the way of getting the tubes and reassuring me it wasn't the end of my life. I have a good relationship with my family doctor here and a good relationship with my HIV doctor here, but it's not warm and fuzzy.
See, for me, it's the opposite. I mean, I had a great relationship with my doctors in the US, but for me here, it's the same. I don't have a problem. If I want, in the US, if I didn't understand a report on my Quest diagnosis, I would usually end up having to call my doctor, because he'd look at it and think, oh, it's no big deal. I'll call him when it's convenient and then forget. Whereas to me, it's like, gee, that number is, 2 points higher than it's supposed to be, or 1 point lower. Is that something to worry about? Well, if I didn't call him and he didn't call me, we figured it was nothing to worry about it eventually. Here, my doctor called me and said, look, you've had this problem with sugar 2 months in a row. I want you to come in. I want to talk to you about getting you on some medication to lower your sugar levels. And let's see how it works. So, it may depend on how significant or what the outlier is. If it's something that's dangerous, I think they'll call you here just as much as they would call you there. And if it's, gosh, you have a 1 point outlier on your blood urea nitrogen and no other indications, so what? It's a question of timing. And nowadays in America, there are so many stories that I've heard. And I used to work at Cook County Hospital in Chicago, where a doctor has 10 minutes to see you because of the patient flow that has to happen. So if they can't look at you, diagnose you, and give you whatever you need in 10 minutes, the next person's appointment is going to be late, and they're going to be fined from their medical group. So they don't really care much anymore in a lot of places, which is kind of sad.
Mm.
And here if I go in to see my HIV doctor, it's like, so how are the kids? Are you going to be going to see your uncle? Just personal conversations and medical conversations. No in and out, no revolving door to his office.
They do seem to be a lot less concerned about keeping to the schedule here, that's for sure. I've said outside.
But it's also about care. They care about you here, I think. Or at least I've experienced what I think of as care, personal care.
That's great to hear.
It's not just about getting more clients through the door. They don't care if they see 1 or 10.
Nice. Cool. So let's go to the group again. Are there any questions from anyone? Cool. Is there anything anyone of you want to add as well, by the way, before we finish up? No, we're all good. Okay. So I guess, like I said, the reason that I brought these guys together, thank you again, James Stanford and Daniel for taking part in this, and thanks everyone for joining us as well. I just wanted to, I guess, break some of the perceptions that some people have that, you know, that if you are HIV positive, you cannot make aliyah. It is, you know, it's a fallacy. Has not been true for a very, very long time. You know, there's absolutely no problem. Again, whenever I get an email, I tell people there are plenty of guys I know that have made aliyah. Um, there's no need to worry about it, and it's not a cause of concern. Again, there are plenty of reasons to get stressed about moving to Israel. Moving country to any country is a huge deal, and Israel really does try its best to help along, you know, with shipments and helping you settle in and so on. So you know, being positive should not be something to add to your list of stresses. Okay, so that's pretty much it. All right. So thank you everyone for coming, and we'll wrap it up. And hopefully I will see you all soon.
Wait, do you have
So
a
just as a
question?
reminder, oh sorry, yeah, go for it.
I just
Daniel,
wanted to thank all of you for being willing to share. And I'm really sorry that more people didn't come to this. There are more of us who need to hear you. Thank you.
Absolutely. Thank you for that, Elisheva. So I will be uploading this to LGBT Olim's Facebook page. And again, for those of you interested, there is the recording from a couple of months ago when we talked to Sa'ar from the Israeli AIDS Task Force. And also, if anyone, I just wanted to put a plug for them as well. They do have a donation page, so I'll put that link underneath the video as well. Obviously, they are government funded, but underfunded. Yeah. So if anyone wants to make a donation, that would be great. And that's pretty much it. All right. So I'll upload this and I'll add the links later on. All right. Thanks, everyone.
Thanks for it.
And hopefully I'll see you all soon. Take care,
Bye-bye.
guys. Bye-bye.
I know. Thank you.
Good night.
That's it.